today we're going to go over hygiene and grooming. This is really where the bulk of your skills in this class come into play. There's a lot of skills involved that you need to also watch the videos for and make sure that you practice all of these skills. Might be helpful before you get too far into this lecture to have your skills assessment record out so that you can write notes as we go. Always have that out when you're watching the skills videos so that you can make notes on what kind of supplies you need or any tips or tricks that you might want to note. So hygiene is everything that we do to keep a person clean, and grooming is everything that we do to look nice. Of course, everybody's going to be a little bit different when it comes to this. Everybody has their own little routine, and that's something that we want to know before we get started. Okay, so if somebody's admitted into long-term care, typically we'll ask them, what time of the day do you like to bathe? What kind of products do you like to use? And we'll try to stick with that as much as possible. We don't want to throw somebody's schedule completely off, And then also any cultural beliefs, find out about those, because some people, they might have beliefs on how often they should be bathing, or if a man or a woman should be in the room with them as they do that. Some of them prefer to have family with them. Those are things that you want to know before you get started. Okay, so these are the skills that we go over for this class. So partial bath for our purposes is from the waist up. I think in your book they include perineal care as part of the partial bath, but that's not how you're tested with Prometric. They separate that out. So just know when we do our skill, we do a partial bath from the waist up. Okay, perineal care is the private area, dressing and undressing, and then we go over nail care and foot care, oral care, and denture care. So I'm going to go over each one of those. So partial bath is from the waist up. Most of the time when you're doing a bath, you're going to be doing a head to toe bath, but if somebody just wants to get freshened up and maybe in the morning and they don't want to go through the whole bath, then definitely at least do a partial bath. So that would be like the video shows you, the face, neck, abdomen, under the breasts, under the armpits, and the arms and the hands, and the back. Okay, and then in our video we include a back rub with that too. So make sure that you are getting the correct products. Like I said, make sure that when you watch the video, write down all the supplies that you need so that you're not missing anything and you have to make multiple trips back and forth, because that's just awkward. Also note the time of day that people like to have this done. Most people like to bathe in the morning, but some people like to bathe in the evening. So that's something we want to know. And then for safety, we always want to make sure that they're a safe distance from the edge of the bed, that if the bed is up, the rails are up, that the water temperature is safe, right? We want to check it, and then we want to have them check it with their hand. And we want to make sure that they have their call bell, the bed is locked, all of those things to keep them safe. Also, when you're doing this, just keep your eyes open, because this is a really great time to make some observations. You're seeing parts of their body that you don't typically see. So you'll see, under their arms, under the breast tissue. You might notice some breakdown happening or sore areas. This is something that you would want to tell the nurse right away. Okay, so just keep your eyes and your ears open, and your nose. So perineal care, this is the anal area, and for females, the vaginal area, and for men, the penis. So definitely you need to know what supplies to get for that. Make sure you watch the video, and this is an area that can be very dirty, so you definitely don't want to cross-contaminate it all, so make sure that you're definitely getting the right amount of supplies. We do this at least once a shift. But if somebody is incontinent, you may need to do it more often. Okay, so you would need to do it as often as is required if they're incontinent. If they're incontinent every 2 hours, then you're doing perineal care every 2 hours. If you're changing a brief, please also do perineal care while you're doing that. That is part of a brief change. For safety, again, water temperature. They need to check the water temperature with their hand before you start bathing. That's sensitive. Perineal area, that skin can be very sensitive, and we definitely don't want to cause any burns down there. And of course, if the bed is raised, make sure that the rails are up. Make sure they're a safe distance. Make sure that you don't leave them in a wet bed afterwards. That's always something you want to say. You know, the bed is clean and dry. And then also be aware of female and male anatomy, because it's definitely different. A big thing to note here is that if you have a male, in the video we show you perineal care on a female, but if you have a male, you would start at the head of the penis and work your way down in 3 strokes. If they are uncircumcised, you will need to pull the foreskin down and clean, wash, dry, rinse, and then replace the foreskin afterwards. If you pull it down and wash, dry, and rinse and you don't return the foreskin back, you can cause a severe problem called paraphimosis, where the head of the penis will actually swell up and it becomes like a tourniquet around the penis. And they can lose their penis for this reason, so you definitely don't want to be the one to do that to them. So you need to make sure that you're getting in there to clean it, because it can harbor a lot of bacteria, but you have to replace that foreskin afterwards. That is super important. And definitely be observant during that time that you're doing perineal care, you know, especially odors, any abnormal breakdown. A lot of times when we see skin breakdown, it's in that area because it's, you know, wet all the time. So, and there's a lot of bacteria down there, so definitely look for that. When you're dressing somebody, consider the time of day, okay? So that if it's daytime, maybe don't pick out pajamas for them, even if that's what they would like to wear. Try to find something that's appropriate for the time of day. Also weather appropriate. You know, if it's winter time, please don't get them a tank top and shorts to wear, even if they think that's what they want. You'll find with dementia, sometimes they aren't able to make wise decisions about what to wear, and sometimes they get overwhelmed with the choices that they have. So you will want to give them simple choices. I wouldn't open up the closet and just be like, what would you like to wear? Because they might pick something that's not appropriate. You should give them maybe 2 choices. You know, would you like to wear this outfit or this outfit? So you're still giving them an option of what to wear, which is something that you need to do, is give them options, but don't overwhelm them with so many options. Okay? Another thing to consider is if somebody has a weak side or a strong side. So, you know, the #1 cause of disability in the U.S. is stroke. So oftentimes when somebody's had a stroke, they're going to have a weak side. So it's much easier for them and you if you dress them by undressing the unaffected side first, which is their strong side. So undress the strong side, and then dress the affected side first. So that would be their weak side. So put it on their weak side and then come across, because then they can move the other side to help you. Okay? And that really only goes for the upper body, because the pants, you know, you put them both pant legs at the same time. Alright, be very gentle with people when you're dressing them. They're fragile oftentimes. We don't want to cause injury. We don't want to hurt them, and then they won't trust us anymore if we do hurt them. So be gentle. Dressing can be really difficult if you have somebody who's contracted, you know, and they can't move for you. But if somebody is contracted, you can still move their limbs. Just be very gentle, you know, slow movements, you know, and don't yank on them. So nail and foot care, we want fingernails to be clean and short. We don't want any rough edges for them to scratch themselves or to scratch us. So we will use a nail file for that. That's also called an emery board. Some facilities let you use nail clippers, but in clinical we prefer that you don't use nail clippers, because we just don't want you to injure anyone. So make sure you know what supplies to gather when you're doing that, and then make observations. If you see, you know, if they've got infections on their skin or their hands are very dry, note that, and if you need to report anything to the nurse, please do that. Want to make sure we use a safe water temperature, of course. For foot care, this becomes especially important, because if we have somebody who has diabetes or peripheral vascular disease or any other condition that causes nerve damage in the feet, they may not be able to tell you that the water's too hot, and then we can cause burns. That becomes very serious with our diabetics, because they're already prone to infection, and they have a difficult time healing when they do get an infection or a cut. So we don't want to cause any damage to them. So have them check it with their hand, always their hand, before you place their foot in the water. Make observations. Definitely look at the bottoms of their feet. You know, not every resident can look at the bottom of their own feet. And then also, if they have nerve damage in their feet from diabetes or peripheral vascular disease, for example, they might have a big sore on their foot and not even realize that it's there. So that will be your job to look in between all their toes, make sure that you don't see any breakdown of any kind. That's one of the most common things when we have diabetics is when they have vascular disease or they don't have sensation in their feet, they start getting ulcers and then they become infected. Okay, so really look for that. So we're going to be putting lotion on, so just be careful with the feet that you don't get any lotion in between the toes, because that can be a moist, warm place for bacteria to just grow and spread, so we don't want to do that. Or fungus, that can happen too. So this can also be a really relaxing time for them because it's, the water's warm, you can give them a nice little hand massage, and it just feels nice. It's a really great time for you to bond with your resident. Sit and talk to them, and maybe even paint their nails afterwards, they like that. One more thing about foot care is that you guys definitely will not be clipping toenails. Most of these facilities have a podiatrist that comes in especially just for that, to clip their toenails, because it's such a high risk. If you accidentally nick them, you could cause them to get an infection that will cause them to then lose their toe or their whole foot. So, we don't want to cause any of that. And if you see any kind of damage on their feet, please tell the nurse right away. So oral care, this is unfortunately something that gets skipped a lot in long-term care. I'm not sure why, but oral care should be done twice a day, every day, for everybody, whether or not they have any teeth. So if they do have teeth, we're going to be using a toothbrush to brush their teeth twice a day and their gums. And we're going to be making observations. We're going to look in their mouth, make sure they don't have any sores or loose teeth that we need to then report, or any kind of infection. And if they do, please tell the nurse. But please make sure that this is being done. It's really unfortunate when you go in these facilities and you can tell when we go and brush their teeth that nobody's done this for a very long time. That can cause tooth decay, and tooth decay becomes a serious problem for a lot of people. It can cause heart problems, it can travel throughout the body and cause them to become septic, and it doesn't feel good to have a dirty mouth. Food tastes better when your mouth is clean. So make sure you're doing that twice a day at least, and then if the resident wants it more often, then we can do it more often than that. And then denture care. If they have dentures, we clean them just as often as we clean regular teeth, twice a day, morning and evening. Okay, we would take them out in the evening and clean them before we put them away, and in the morning we clean them before we put them in their mouth. But you need to also be aware that you have to do oral care with this. So you have to clean their mouth even if they don't have any teeth. And to do that, we'll be using a toothette. You'll see that in the skills video when you watch it. But you don't want to put clean dentures in a dirty mouth, right? And we definitely want to be brushing those dentures well. They get food particles stuck in them, and that can cause infection. So please be careful with that. And we are always going to store them in their own container that's labeled with a person's name on it. You don't want to, confuse roommates' dentures with each other. That's not pleasant. And make sure, especially for dentures, that you're using cool water or lukewarm. Never use hot water on dentures because they can warp. Okay? So lukewarm is okay, but I prefer just to use cool so that there's no risk of that happening. So of course we have the massage. For the massage, you want to make sure you start at the bottom near the buttocks and moving up either in long smooth motions or short circular motions. Okay. We don't do any kind of deep tissue massage. For shaving, we shave in the direction of hair growth, so don't shave against the grain if you're shaving a man's face. Okay. And then for hair care, we just try to find out what their preference is for that. Most people get their hair washed twice a week. Sometimes that's done in the beauty shop, so just find that out before you do it. And that's about it.